No matching about a Kessben matches within Edikojo Prepom Dankwa. And then the MP for West Central Office on Minister for Labor, Jobs and Employment, Honorable Abdul-Rashid Pelpuo, and Edin Komo, Ejuma, and the Eko, and the Benina. Indeed, Matter said a necessary crime on semi or demonstration, almost striking, and no crime on some clever beginning and Komo and then Anope. Honorable, morning.
Thank you, good morning.
I'm sure as well.
Everything is fine.
Nice. Now, let's start with the issue concerning the Ghana Registered Nursing Association and the Midwifery Association. Is there any updates that we need to know as Ghanaians?
Well, as government, we are worried. We are determined to make sure this thing comes to an end. I've had a meeting with the executives. We've had some discussions. They are insisting on what they want. Government is taking it very rightly to them, say, and our position is that it is too early for us to begin to, extract from the economy. We are building an economy that had been completely run down. The challenges are huge, and taking over office and trying to stabilize things, stable the economy and stable the currency, ensure that we run a system that can be friendly to the public and to the private sector. It is disturbing that such strikes are occurring. So we are telling them, look, they are not the only ones who have challenges. Several challenges are coming from other organizations. We are tackling them as a whole. We don't want to separate them and tackle them. We are tackling them as a whole. We are committed to getting to the bottom of it. If we are able to stabilize this economy and get it to grow the way we want, we can have peace. So we are telling them so. They have heard us, but they are continuing with the strike. And I hope that as we go along, hopefully they will get to understand and give up their strike.
As we go along, we still have issues. 4 to 5 days now, we still hear reports. People dying. We still hear reports of people attending hospital and yet they don't get any help from people. I've seen too many things happen on social media. People confessing their 18-year-old children. Some parents are off and on and all that. What will be the timelines for these things to stop? Since we're still having negotiations and yet they're still not back to work.
You see, in Ghana, we believe so much in taking it to the level of strike. When you begin to negotiate, it is important to look at the realities of the day. Why would we get Ghanaians dying because you are given the chance to negotiate to a certain level and you feel there's delay and you begin to go on strike? They make a quotation to say that they started this thing long ago, last year, and by May 2024 they have reached an agreement, and so they expect that by the time we take over office we should have been implementing it. You can't implement a system you don't understand. We took over an economy. The economy we took over, we did a budget. After 3 months of a budget that was meant to help in the transition, we now did a budget for the next 9 months. And they expected everything to be put in that budget. And we told them, this is not going to be possible. We have not rejected their demand. We simply say, let's wait and let's run this economy up to a point when we can respond. They are angry about that and they decide to go on a strike. Now you are quoting that, you are telling me people are dying.
Sure.
And people go to hospital, they have no nurses to take care of them. The reason they are striking is that they want their collective agreements to be enhanced. They want allowances for their uniform. They want allowances for the car fuel allowances and those kinds of things.
180 liters.
Yeah.
Book allowance, uniform.
Book allowance, uniform. So that's waiting until we can respond to it and allowing people to die who cannot be revived. Which one is better? So it is a concern we all are expressing.
But can't government look at these agreements that the bargaining agreement that they are requesting to say that, listen, we can offer you, let's say, 1 or 2 of it, so that you can go back to work? Can it be done?
They haven't given us the opportunity to suggest that. They have gone on strike. After they had insisted on what they want, government kept telling them what they can do and what they cannot do, and they decided to go on strike. Truth is that government has not made proposals in any of the directions we have talked about. We just want to take it as a whole and address it as a whole. But we want space to be able to do that. And when we told them, allow this year to pass, and we hit the grounds next year and work on it, they won't allow it. So that's the problem.
Not allowing and still having discussions on, and people are still dying.
Yeah. I wish you could ask them. Because government is not the only stakeholder in this. There are stakeholders too. We are our brothers keepers. Every single Ghanaian is a brother's keeper of the other. And so if if there's a challenge like what we are saying now, what we are seeing now, it is something that can be solved by 2 parties. In fact, 3 parties. The rest of it is civil society. They have to demonstrate their desire to see peace going on and people having treatments, nurses going back to work, peace prevailing in our body politic, so we can have things worked out in manners that will not disconcert anybody.
The health minister brought an issue, or brought a solution, I should say, to say that, listen, if they are not, going, the next thing that we need to do is to bring in the retirees, the midwives and nurses, to come and then take over. Do you share the same idea?
Yeah, that's what can help the situation where people are dying. We can't wait for them when the money is not there for them and they keep striking and people are dying. We better save lives. So what he has suggested is very logical. It's something is comprehensible. It's understandable, if you look at the whole circumstance of the issue that because of strike actions, people are losing their lives. You better do something to stop it from happening.
But people have said that in as much as we bring in the retirees, we're still going to pay them some form of allowance. Now these allowances, you're going to pay these retirees for them to come to a selected kind of hospital for people to attend to. It's not the same money you were then said or decided to say that, listen, we're going to then channel this money into your bargaining contract that you want to see us, execute as government.
Yeah. I hope you are not seeing it to be a one-time payment they are looking for. The ones...
the ones that are one-time payment, for instance, they send their uniform is once a year, 1,000 Ghana cedis for their uniforms. Book allowances are just for, one-time payment and all that. So they are kind of one-time payment within their bargaining plan.
It's not one-time payment per se, it is consistent payment. Either you work it into their salary and pay them gradually, or you pay it as a whole every single year. But if you get these retired nurses to help this year, you're only paying them for this year, that is all. But at least you save lives. And there are various suggestions coming up as to how to tackle this. The court is there. We are asking the Labour Commission to tackle it. We are asking them to discuss with them, and let's see what is going to come out of it. If eventually there is some logical conclusion to it, thank God, that will be fine. But let me assure the nurses that we are not against your demand. It's a necessity. We want to see you work. We want to see you happy as well. We want to make sure the health condition of our people is taken care of comprehensively. And then your duty is to get back to work in fulfillment of your whole commitment to save lives and to keep people healthy. So don't see government as an enemy. We simply are new in this governance situation we find ourselves. And it is not bad, it's not news for you that we are doing so, working in an economy that had been completely run down to an extent that we need to rebuild it. So in the situation like this, create the wealth and spend it. If you don't create that wealth, there's nothing to spend. If you come in and insist on what you want, the next moment, CLOSAC is coming in to insist on what they want, then the teachers are coming in and their workers are coming in to demand. I have a lot of stretch of work, labor organizations making demands and threatening strike. Now we have two options. Let's fulfill your demands and run down the economy and continue to rebuild. You get the money that you have no use. So I think that you listen to us, we are with you, we will work with you. Eventually we will not go without fulfilling your demand. But just be patient and that will be it. Once you are patient and we work along, nothing can be left undone in this your demand. Yeah.
Thank you.
Thank you
for this one. I should phone you for your name, Honorable Abdul-Rashid Pelpuo. Like me saying the name Hassan Pelpuo. MP for West Central Office of Sun Minister for Labor, Jobs and Employment. Name Komo FI. Next for no a strike no. So pacho. The economy. Yes, someone. Yenemoa na BBA. It's in Munya Motre. BBA a bear fine. Good you